Hello to everyone. My name is Mustafa Zuhair Mahmoud Al Hassan, and I am a professor and consultant of radiology and ultrasonography at King Khalid University in the Kingdom of Saudi Arabia. My talk will be about the knowledge, awareness, and attitudes of Sudanese radiology staff toward workplace violence. My co-authors are also listed in the current slide, along with their affiliations. As an introduction, the National Institute for Occupational Safety and Health defines workplace violence as violent acts, including physical assaults and threats of physical assault, directed toward persons at work or on duty. Additionally, physical assaults or threats that causes or threaten serious bodily harm are often the focus of enforcement efforts. Many cases of workplace violence against healthcare personnel have been recorded in the past and continue to be reported from all across Sudan and the world. According to the proposed 2015 National Health Strategy, an increasing percentage of households are suffering catastrophic health care costs. As a result, hospital violence has been identified as a significant issue for healthcare providers in developing countries, where individuals are expected to pay for their own healthcare costs, which can be unusually high at times. However, violence is not restricted to developing nations. It's much greater even in affluent and prosperous countries where health is a state subject and money is not an issue. In terms of purpose, the study's goal was to shed light on the incidence of workplace violence in this regard. This study investigates the knowledge, awareness, and attitude regarding violence in Sudanese radiology departments. Now, I will go over the material and methods section, beginning with the section selection and description of participants by stating, from November 2021 to March 2022, a descriptive qualitative survey was done among 138 participants working in radiology departments at 15 Sudanese hospitals. With the support of contemporary scientific research, the authors developed this survey questionnaire to cover major areas of prevalence in radiology departments, as well as knowledge, awareness, and attitude toward the model provided by World Health Organization guidelines. There were 3 sections to the questionnaire. The first segment addressed socio-demographic and occupational factors. The second piece talked about how often workplace violence is in the radiology department. The third component comprises questions about knowledge, awareness, and attitude toward workplace violence. Concerning the second part of the material and method section, ethical considerations, I'm going to say the study was conducted in accordance with the Declaration of Helsinki's ethical standards and was approved by the National Ripat University Faculty of Radiology and Nuclear Medicine Sciences Research Committee. Participants were informed that their participation in the study was entirely voluntary and confidentially, that they could withdraw at any time for any reason, and that they were providing informed consent to the study by completing the questionnaires. The third component of the material and methods section is devoted to statistical analysis, in which all study variables data were submitted via Google Form and Microsoft Excel 2016. In the form of comparison tables and graphs, all measurable data were provided as a mean standard deviation, while the standard statistical package for the social sciences version 20 for Windows was used for statistical analysis. In terms of outcomes, 57 males and 81 females from the field of medical radiology participated in the current study, according to the current survey results. Participants in the study range in age from their 20s to their 60s, with educational degrees ranging from diplomas to bachelor's, master's, and doctoral degrees in various medical imaging specializations. It's also worth noting that the survey respondents' clinical experience in medical radiology ranged from 6 to 20 years. Here is table number 1, which, as you can see, contains demographic information as well as general characteristics of the study group. The study also found the percentage of radiology employees' knowledge of workplace violence and volatile people in radiology departments based on their yes or no answers to questions about sufficient knowledge of workplace violence, receiving training on how to deal with violence, and accountability that they are in direct contact with volatile people. Table 2 on slide 11 discusses radiology staff understanding of workplace violence and volatile personalities. In addition, radiology staff knowledge of healthcare system violence prevention strategies and radiology department violence prevention strategies was measured for both expected and unexpected knowledge. Furthermore, the results show the radiology staff's knowledge and attitude toward violence and the employer's comprehensive written regulations and violence prevention program for reporting and responding to violence. Here we have Table 3 that indicates the healthcare system and radiology department's awareness of violence prevention techniques for radiology professionals. Furthermore, Table 4 also demonstrates radiology personnel's awareness and attitude against violence, while the information in Table 5 shows the radiology staff's understanding of the employer's comprehensive written regulations and violence prevention program for reporting and responding to violence. This study also found that workplace violence decreased radiology staff productivity, turnover, absenteeism, and attitude. In addition, the study found that flushed or pale face, trembling or shaking, loud talking or chanting, rapid breathing, and glaring or avoiding eye contact increased radiology staff knowledge of personnel characteristics associated with workplace violence. In Figure 1, a clear depiction is presented illustrating the impact of workplace violence on radiology personnel. Figure 2, on the other hand, explains radiology staff's knowledge of potential workplace violence. In the discussion section, to reduce workplace violence among radiology professionals, it's recommended to assess their knowledge, awareness, and practice, followed by an evidence-based awareness and educational program. Radiology employees were aware of occupational violence according to this study, which collected 138 responses from all 18 Sudanese states. Most respondents knew of workplace violence. Unfortunately, the study also indicated that radiology staff at private and public institutions were unaware of violence prevention techniques. To continue, about 94% of respondents said that healthcare personnel should avoid any violent circumstances. Furthermore, 99% of respondents agreed that in order to protect themselves and their rights, staff should report any violent situation to hospital administration. Our findings are perfectly consistent with the findings of a study conducted in Saudi Arabia to explore healthcare workers' understanding of a violence reporting system. More than 55% of respondents in this study said their departments lacked a detailed written policy for reporting or responding to workplace violence. As demonstrated by two comparable studies, this has a direct impact on the provision of high-quality healthcare. When it comes to the impact of workplace violence, all participants agreed that it had an influence on employee performance and workflow. This is consistent with the 2015 study by Lin et al., who discovered that workplace violence had a negative impact on the job performance and quality of life of community health centers personnel. Furthermore, following training, the frequency of various forms of violence, such as physical, psychological, sexual, and racial violence decreased, According to the findings of a study conducted as a quasi-experimental study in 2018 to assess the impact of a workplace violence training program. Moreover, our work is limited by population variability due to the randomized selection approach, which may affect our results and weaken our conclusions if additional age groups are employed in future investigations. Other study flaws included a limited cohort sample size, poorly planned distribution channels which resulted in biased data, low response rates, and many other difficulties. Furthermore, to the best of our knowledge, this is the first study to measure Sudanese radiology staff's workplace knowledge, awareness, and attitude toward workplace violence, which can be viewed as a strength added to this study. In conclusion, Sudanese radiology staff's view of violence is positive. Workplace violence prevention and management training yields better results. Violence response training reduces radiology department violence, and direct patient contact makes staff more prone to violence. The survey also found that working with violent person is the most harmful. To strengthen violence prevention measures in all government and private hospitals in Sudan, a central regulatory authority on workplace violence prevention training programs must be established to raise awareness. As an acknowledgement, the authors extend their appreciation to the Deanship of Scientific Research at King Khalid University for funding this work through large group research project under grant number RGP2/387/44. Now, in this final section of the presentation, I will go over the study's references with you. More research references can also be found here. Here are some other resources that helped shape the current presentation on Sudanese radiology staff knowledge, awareness, and attitudes toward workplace violence. This slide, number 29, concludes the review of the current study's references. Finally, I would want to thank you for joining to this presentation, and I hope you found it informative. Please accept my heartfelt gratitude and appreciation. If you have any concerns or inquiries, please contact me via the methods of communication displayed on the screen.